is the Practi powder. And I should have had you all grab one, but you all did practice with this when you did the assignment, looking at the label on the Practi powder. So it says Practi powder, 1,000 milligrams, IV, Q6 hours, and it says it's going to go in 50 mLs of normal saline. That's because that's all we have. And the rate is 25 milliliters per hour. So with this one, it says Practi powder, 1,000 milligrams. So what you do is you look at the vial of your Practi powder and you look to see what concentration can I make it. And so if you remember from the assignment and maybe from last semester, you can make it any concentration that you want, but the concentration that you make it will depend upon how much diluent you put in it. So this says, it gives instructions for making it 300 milligram per milliliter concentration, a 400 milligram per milliliter concentration, and a 500 milligram per milliliter concentration. Which one do you think would be the easiest to make it? Yeah, so since we need 1,000 milligrams, it's easiest just to go ahead and make it 500 milligrams per milliliter. So to make it 500 milligrams per milliliter, it says amount of diluent to add is 5.6 mLs. So what I would do is take 5.6 milliliters, and it says here sodium chloride would be what you would dissolve it with. I would take 5.6 milliliters and add to this vial, and then I would dissolve that, and my concentration inside the vial will be 500 milligrams per ml. So if your concentration in the vial is 500 milligrams per ml, then how many mLs do you then need to pull out of this vial and push into the bag? 2 mLs, that's right. All right, and so this says that you need normal saline to dilute it with. You can actually dilute it with the normal saline from the bag, or typically in hospitals they have like large volume bags that they have hanging. We don't have any racks in our IV hoods, but typically they have large volume bags that they have hanging that they'll use throughout the day. You can draw the volume from that as well. So for this, I'll use the same syringe. Alright, so for this, you'll need the large volume bag that you'll draw it from, or it's okay too if you would draw it from the same solution that it's going to go back into. So you'll need the large volume bag, you'll need your 50 mLs of normal saline, and the reason it's okay to withdraw from this bag is because there's usually overfill in these bags. So even though it says 50 mLs, it may actually be closer to 60. So there's usually a little bit of overfill in here. And then you'll need your vial, and of course you'll also need your alcohol swab and your syringe and needle. Now we do have 5 cc syringes, 3 cc syringes, 10 and 20. The reason I'm going to use the 10 cc syringe is because I have to take 5.6 mLs and push in here. So, and you can just use the same syringe. So since you needed 5.6 mLs, you just go ahead and use your 10 cc syringe. And you don't have to switch to another syringe to withdraw the 2 mLs. You can just use the same one. Because students will often do that, but it's okay if you just use the same one for the purposes of not wasting another syringe. So you line everything up under your hood. Again, making sure, since our hoods have vertical airflow, that you're not stacking stuff on top of each other. What you'll do is you'll go ahead and take the cap off of your vial. And to do that, you can just push up with your thumb, and it usually goes flying. It didn't go flying that time. Alright, and so then for everything that you either are going to insert a needle into or any IV ports, you want to go ahead and make sure that you swab it with alcohol. So I'll open up my alcohol swab, and I'll swab the top of the vial. I'll swab the port that the medication is going to go into. And since I'm going to take 5.6 cc's from here, I want to make sure this is sterile too. And so I'm going to swab this port here as well. Oh. So once you've done that, you go ahead and you open your syringe. And you take your cap off of your syringe, and you see it's coming off because it's cheap. If that happens, just screw it back on. I won't take points off of the OSCE. So just screw it back on, take your cap off, And the first thing I'm going to do is take my 5.6 cc's from here and then push into the vial. And what I'm going to do for the Oskies is they're a little, I don't know what you call it under the hoods, but I'm going to have them hanging to make it easier for you all. What I'm just going to do is hold it. And since I'm holding it sideways, I'm going to pull out a little extra and then just push out what I don't need. So you would take and insert your needle into the IV port. And I'm trying to push out 5.6 cc's, but since I can't really see from the side, I'm just going to push out a little extra and then just pull out what I don't need. But when you're under the hood, it'll be hanging, so you can do it like that. And remember, try to, as much as possible, not to do this. You know, if you touch it like that, I mean, it's okay. It's not the easiest thing, especially if you have smaller hands. But as long as I see that you're trying your best not to hold it like this, you know, try to, as much as possible, not to touch the plunger, the inside of the plunger there. All right. So I probably went overboard with how much I pulled out. So I pulled out way more than I need, so I'm going to go ahead and take and push out what I don't need onto the floor of the hood, so that I'm up to 5.6. And you can actually do that. That's okay. And remember, when you're looking at it, make sure you look carefully at the markings on the syringe to make sure that you have the right amount. And so for these, each marking is 0.2 for this particular syringe. All right, and so I'm at my 5.6 cc's. And so now what I'm going to do is take and put my 5.6 cc's inside of the vial. And do you guys remember how you're supposed to go into the vial?
45 degrees.
Yeah. Yeah, so at a 45-degree angle, and do you remember why? Yeah. So the reason it's recommended that you go in at a 45-degree angle is to prevent what they call coring, where you get some of the rubber part come off and then it'll drop into your solution. Because if you go in straight like this, you'll get coring. And so you don't have to put it in like this, because I see students keep it at a 45-degree angle when they go in. When you put the tip of it in, you do it at a 45-degree angle, and then you can go up and down. Because it makes it difficult if you're going like this, and you go all the way in at a 45-degree angle. So you can just put the tip in at a 45-degree angle, and then you hold it straight up and go down. Yeah, because it makes it difficult if it's in the side like that. So once you put it in, then what you'll do is you'll go ahead and push in your 5.6 cc's. And with vials, they're usually pressurized. So if I'm pushing liquid in there, there's pressure that's going to build up inside. So what you want to do is, before you take your needle out, is go ahead and let the syringe go to let some of that pressure that's built up come out. If you don't do that, when you go back in, you might have it kind of splat a little bit. Has that happened to anybody? No, not really. You might have it splat a little bit. So whenever you're putting liquid into a vial, remember vials are pressurized, you push that liquid in and just let that syringe go to let some of that pressure come back out. And once you've done that, you go ahead and just swirl the vial to dissolve the contents. You don't have to do it like this. You can just swirl it so that you dissolve the contents. And so now that I put my 5.6 mLs in here, now I know I have a concentration of 500 milligrams per ml in there. And so now all I have to do is go back in there and take my 2 mLs out. So again, whenever you have vials, they're pressurized. So what I have to do is always make sure I keep that pressure in their balance. So if I'm going to pull out 2 cc's, I want to push in 2 cc's of air first. If I don't do that, when I go to pull the liquid out, it's going to try to suck it back up. And what might happen is you might lose some of your volume without noticing it. So make sure you go ahead and push the 2 cc's, or however many cc's it may be, back in there. So I pull my syringe down to 2 cc's of air. I'm going to go ahead and push my needle back in at a 45-degree angle, but I can go straight up before going in. And don't do it like this, trying to get the volume out. Turn it all the way over upside down. If you do it like this, or you try to do it like this, it's going to be very difficult. So when you're trying to get the volume out, turn it all the way upside down so that all that liquid's in the bottom. And before you begin pushing the volume out, make sure that you pull your needle down so that it stays below the liquid. Because what will happen sometimes is students may not realize that their needle's is not in the liquid and it's in the air, and they keep wondering why they keep getting air and not liquid. So make sure you pull your needle down so that it stays below the liquid. So I'm going to go ahead and push my 2 cc's of air in, and if you notice, the pressure's balanced, so even without trying, it's going to come back out on its own. But you still may have to go ahead and push it down to where it needed to be. So I'm going to push it back the rest of the way to 2 cc's. And if you see any air bubbles, again, you can tap the side of the syringe to push the air bubbles to the top. I see little bitty ones, so not a big deal. But if you did have air bubbles, tap the side of the syringe, push the air bubbles back to the top, push the air bubbles back in, and then pull back down again to get to where you want to be. And so I pull down to 2 cc's. I'm going to take my needle out, and then I'm going to make this bag yellow like the rest of them. And I'm going to take my 2 cc's of the Practi powder, push into the center of my IV bag, and I'm going to remove my needle, and then you can just go ahead and discard of the syringe. And again, if you're going to recap before discarding the needle, go ahead and recap it this way versus like this. But if you're just very afraid and you don't want to recap, it's okay if you go ahead and just put the whole thing in the sharps container. So any questions about this part? No questions? Please?